This is the PRI 90-90 ball squeeze position. This is a subtle but important and useful drill for creating space or opening up the space at the back of the pelvis. So these will be chronically tight tissue here on the back side of the pelvis that connect around the sacrum and the pelvis itself. So they get chronically compressed. This is a little move that creates a little bit of separation at the SI joint, a little bit of flexion versus extension, again, to help orient these muscles onto a little bit of a, you can almost call it like a stretch. But it's a subtle little move, and it can be really important and helpful for folks with kind of chronic low back tightness, any sort of radiating pain and things like that. So for this move, we're in our 90-90 position. We want 90 degrees at the knees, 90 degrees at the ankles, 90 degrees here at the hips. Ball between the knees, but we're actually going to drop it a little bit lower. You can use a foam roller for this as well. From here, we're pressing our feet into the wall just slightly and then dragging them down, but the friction keeps them there. What that's going to do is pull your pelvis slightly off the ground. From here, we're going to squeeze the ball or the foam roller. And again, this action of creating adduction and an adduction moment at the hips will create this, what would be expansion at the back of the pelvis. All we do from here is keeping our pelvis off the ground, keeping this squeeze, is inhales through the nose, long exhales through the mouth that pull the rib cage down, down, down. So you need to let every last bit of air out as you exhale and feel these muscles around the abs start to kick on, especially on the sides. And you'll notice that the rib cage gets pulled down as those muscles contract. Keep that rib cage there. All the muscles that just kick down, keep them. Then slowly inhale through the nose while you keep that tension, and you'll feel the rib cage kind of start to expand. And we can even get some expansion to that low back and back of the pelvis. So we neutralize or create a neutral position at the pelvis and rib cage, and then we create expansion through our breath and through our static hold here at the hip and pelvis. What we're going to do is just hang out and hold here 45, 60 seconds, just try and take big, long, slow breaths and just let that process happen. Give it a shot.